and good afternoon. It is Friday, time for our regular Lunch and Learn. And today we're going to continue. We ask you questions. We ask you what questions you had that you wanted us to answer. And I have a little sheet right here, and we went through several of them last week. We're going to go through a couple more today. We may finish today, we may not. It just depends on, how we go, how we do. So I appreciate your involvement, because there's no point in doing this if you are not getting anything out of it, if you are not, if it's not meeting your needs, then I'm just sitting here talking and wasting air, okay? So there's two questions that we're going to start with first. One of them is pituitary tumor. Doesn't say, I have one. What do you do about it? How did I get it? So, when you're putting these things out there, you're just giving me really broad brush strokes. So I'm going to answer broad brush strokes, and then if you need some more information, you can let me know. And then the other one was problematic ovarian cysts. So they're connected. They are related because your pituitary has hormones that cause your ovaries to do what they do. So I was going to show you this photo. Here is your pituitary gland right here. All right. You can see, there it is right there. So it's at the very, very bottom of your brain. It's got two sides to it, two hemispheres to it. And it's very, very small. It's about the size of a pea, and it sits below your hypothalamus. Now, in your brain, you've got a pituitary gland, a pineal gland, and a hypothalamic gland. Now, all those three glands work together. They're your master glands, and they cause all the rest of your hormones to work in concert and do what they need to do. So this is really, really important, because if your brain is not working correctly, then nothing else is going to work correctly. So when you come and see me and you're sitting across the table from me, one of the things that I'm going to do is I'm going to do some energetic testing with my little tool over here, and I'm going to measure whether your brain is getting the same frequency on the right side and on the left side, okay? Why am I going to do that? I'm going to do that because if you're not resonating together, in sequence, then nothing's going to cross the blood-brain, well, not the blood-brain, but the corpus callosum. Yes, you've got all these things in your brain. It's not going to cross the corpus callosum, and so your brain's not going to be getting the right messages. So all of your glands in your brain control all of the hormones in your body. They tell the other endocrine system glands to release their hormones. They also carry messages to your skin, your muscles, and your other tissues, and they all tell your body what to do. Now, one of the hormones that it makes is your, now I'm going to say this. If I get it wrong, y'all just give me some grace. It's about a 15, syllable word here. Adrenocorticotropic hormone, okay? It plays a role in how your body responds to stress. It stimulates your adrenal glands to produce cortisol, which is the stress hormone, and it functions in the body to regulate your metabolism, maintain your blood pressure, regulate your glucose levels, and also reduce inflammation. It produces your follicle stimulating hormone. You may see this on your blood work as FSH. FSH, if you're a man, causes your sperm to develop. If you are a woman, it causes your ovaries to produce those eggs. So FSH can be a factor in ovarian cysts. So I wanted to start with pituitary first, because that gives you a background on what might be going on with your ovaries, okay? The follicle stimulating hormone is known as a gonadotropic hormone, okay? It produces growth hormone. Now, in children, this causes your children to grow, and as an adult, this hormone causes your body to maintain healthy muscular function, and also it impacts your fat distribution and your bones. So if you have any kind of problem with your metabolic system, then you probably have some problems with your pituitary gland, okay? Also produces your luteinizing hormone. On your blood work, you'll see LH. So luteinizing hormone causes your ovaries to ovulate. All right. And so it is also known as a gonadotrophic hormone. Prolactin is stimulated by the pituitary gland, and prolactin causes your mammary glands, your breasts, to produce to produce milk when it is supposed to. One of the key features in locating a pituitary tumor is that you have milk production and you're not pregnant. I'm going to sneeze. You have to give me a minute. So that's one of the ways that they can diagnose a pituitary tumor. If you are a lactating woman, but you're not pregnant and you've not just given birth, that could be something in the pituitary gland, all right? The pituitary also releases the thyroid stimulating hormone. It causes your thyroid to produce thyroid hormones to manage your metabolism, energy levels, and your nervous system. So this is really, really important because your pituitary is really, really powerful. It's a powerful gland, all right? Also produces your antidiuretic hormone, also produces oxytocin. So oxytocin is stored and released by the pituitary gland. When you are a female, it helps your body change and give birth, okay? It also helps your milk to flow, all right? And also it helps bond with the baby. It also plays a role in moving sperm if you're a man. So lots of things going on with the pituitary gland. So we want to look at that and see what it is. Now, your pituitary gland is like a thermostat. So when you're in your home and you're a little bit too hot or you're a little bit too cold, what do? You go over and you change the thermostat, because that's what we do. When our body is not functioning exactly right, your pituitary is your adjuster, all right? So it makes everything work the way it is supposed to. So it gets your hormones doing what they need to do. It gives you the right settings for your body depending on your age and your sex, okay? So that's really, really important. So we've got all of those hormones that go to the pituitary gland. Now, if you have a pituitary tumor, nobody knows what causes a pituitary tumor. So I know you wanted me to say, oh, well, if you do this, you're going to get rid of the pituitary tumor, right? Nobody knows what causes it, but I can tell you some symptoms. I told you before, lactation, when you're not pregnant and you've not just given birth, that's part of it. That's a sign. Because your pituitary is close to your optic nerve, if it is a larger tumor, you can have vision difficulties. Also, you can have nausea and vomiting because it messes with that part of your brain. All right. Any tumor that puts pressure on your brain can cause nausea, vomiting due to a headache and reduced blood flow, or inappropriate activation of the vomiting center in your brain. I bet you didn't know you had a vomiting center in your brain. Okay. I hate to vomit. I don't know about you, but that just kind of, I don't like it. Don't do it very often. Thank goodness. Don't do it very often. Sometimes, if you take very, very powerful vitamins on an empty stomach, it will cause you to be nauseated and to throw up. So pituitary tumors, again, I'm not quite sure what you're asking about that, but pituitary tumors damage the parts of the gland that are responsible for producing hormones, cortisol, TSH, and that kind of thing, okay? Decreased TSH and cortisol from damage to the gland can cause several systems in the body to slow down, including the gastrointestinal system. So your GI tract, and we do a lot of work with the GI tract, right? We know that the pituitary not acting the way it is can cause that to be a problem. When the gland slows down, it can cause there's a medical condition called gastroparesis. And what that means is that your food does not move through your system. It takes a long time to move through your system. And that is something that we usually give a stimulant herb to that to cause that muscular contraction to continue. But it can be something going on with your pituitary gland. When the food stagnates in your digestive tract for too long, you can feel nauseated and you can vomit, and it can cause you not to even want to eat. Deficient amounts of these hormones in the body can also reduce an individual's heart rate and breathing. This also can cause nausea and vomiting due to low blood pressure, and dizziness. So those are the symptoms. Most of the time, they don't do anything about it if you have one. They measure it. They go and do an MRI. They do a CAT scan. They do all the tests that they do. And normally they're very, very small tumors. Normally they're benign tumors, so they don't usually do anything about it unless they're causing just a whole lot of problems for you with, vision or low blood pressure. I mean, you can die with low blood pressure, right? And so we don't want that to happen. We don't want anything like that to happen to you. So hopefully that answered your questions about pituitary tumors. Nobody knows why you get them. Now, I have a suspicion about any anomaly in the body. For me, holistically, let me back up. When you go to a medical doctor and you say, "Doctor, I don't feel good, blah, 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 blah," and they say, "Oh, well, we have found in all of our various examinations that you have a small pituitary tumor." Okay, what are we going to do about it? Nada. We're not going to do anything about it. That's normally what happens. So the doctor is going to label you on your folder that you have a pituitary tumor, and they're going to periodically recheck and see what's going on, make sure it's not growing and that kind of thing, which I think, yes, that's a good idea. They should do that. What we want to do holistically is to find out why your body decided to make a tumor. A tumor is not a normal thing, right? So the way the body is constructed, you're supposed to have good nutrition. When you absorb that nutrition, those nutrients go into your body and they cause your glands, your cells, your muscles, your bones, your organs, whatever we got, right? It causes those things to function the way they're supposed to function. Now, if you've been following us for a while, you know we've got this little device, and you can read, it says Pharmanex on it. This is my PS3 scanner. So what does that do? Well, it's a little 30-second test. You put the heel of your hand right on a little blue laser. You let it sit there. It goes and it does all its scan. And what it's doing is it is reading how much of the bioflavonoids, the carotenoids that you are eating, you are absolutely absorbing. Why is that? Because the body takes that raw material from the fruits and vegetables that you're eating, and it changes it into antioxidants. And those antioxidants go after anything that's wrong in the body. It goes after free radicals, goes after a whole lot of things, and it causes your immune system to work the way your immune system is supposed to. So when our body works the way it is supposed to, then we don't grow tumors, okay? So at the bottom line, the cause of every dysfunction is a nutrient deficiency, or you've got parasites, viruses, bacteria, heavy metals, chemicals, all those kind of things. And we live in a dirty world, guys. I mean, we can be clean. We can use the best products that we can get our hands on. However, the atmosphere is contaminated. The air is contaminated. The ground is contaminated. Probably everything that I'm wearing is synthetic. So, hello, I'm not even supposed to wear that, right? Because that's not a natural fabric. There are dyes in our clothes. There's dyes in the carpet. We've got Wi-Fi. I've got computers all around. We've got Wi-Fi in here. Now I've told you this before, I wear a little diode in my bra because I want to project a force field out there so the Wi-Fi doesn't get me, the 5G doesn't get me, and all that kind of thing, and we do the best we can with that. At the bottom line, if I'm not absorbing my nutrition, nothing's going to work for me because that is the fuel my body needs. Your body does not need synthetic food that is not food, genetically modified food. When that's all you're eating, then your body is going to shut down because it doesn't have the raw materials that it needs to repair itself. So this is a hard concept to get across. And so I tell people, especially my men, right, because men are going to eat what men are going to eat. And I just ask them, okay, so you've got a truck out there, you've got a car, whatever it is. And they'll start telling me about, oh, they got this, 10-ton truck, whatever they've got, right? They're so proud of their truck. And so I said, well, I bet you put milk in the gas tank, don't you? And they'll go, Dr. Polly, I would never put milk in the gas tank. Because if I put milk in the gas tank, my truck will not run. Bingo. All right. Same thing with your body. When you're putting synthetic ingredients, genetically modified ingredients, foods that are not foods, into your body, you are doing the equivalent of putting milk in your gas tank in your truck, and it's not going to work the way it needs to work. So hopefully that's a word to the wise. And if you do have a pituitary tumor, come in and see me. We'll see what's going wrong in your body, and we'll figure out how to put it right. And I just believe the body can heal itself of everything. That's just how I am. Now, the next question that we received was problematic ovarian cysts. Now, we talked about the pituitary producing the follicle stimulating hormone and the luteinizing hormone. Now, these are gonadotropic hormones. Go to your gonads. Your gonads are ovaries if you're a woman, testicles if you're a man. You don't get a choice. That's what you get. That you get it at birth. That's who you are. Okay. So your follicle stimulating hormone stimulates the eggs to grow in the ovaries. So during the woman's menstrual cycle, the egg grows in a sac called the follicle. The sac is inside the ovaries, and in most cases, this follicle or sac will break open and release the egg. The egg will travel down, the fallopian tubes go into the uterus, hopefully met by a sperm. They unite, they attach to the inside of the uterine wall, and bingo, that's how a baby is started. If you do not have a sperm that is waiting to catch that egg, when that egg comes, there's no sperm, it can't ignite that spark to stick into the uterus. It'll come out. That's your monthly cycle. That's how that works. Sometimes a woman's ovaries do not work correctly, and you may have too much follicle stimulating hormone, which can stimulate more than one egg and that kind of thing, which can cause a follicular cyst. Now, if the follicle does not break open, the fluid inside the follicle can form a cyst on the ovary. You also can get something called corpus luteum cysts. These cysts are also in the follicle. The follicle usually dissolves after the release of the egg. But if the sac doesn't dissolve, then that follicle seals over. There's fluid in there. More fluid can actually get in there, and then that accumulation will cause that to become a cyst, and it causes the corpus luteum cyst. Other types of cysts include dermoid cysts, which are sac-like growths in the ovaries that contain hair, fat, and other tissues. I don't know how you get that. That doesn't sound very good. You've got something called castadenomas, which are non-cancerous growths that can develop on the outer surface of the ovaries. And then you've got endometriomas. I hope I said that right. Tissue that normally grows inside the uterus. Inside the uterus has endometrium. When that gets inflamed, that is called endometriosis. I personally think that is a fungal pattern. That's what I think. We look at it that way. We have really good results with that. So if that's something that bothers you, that's something that we can kind of work with that. But sometimes, and I don't even know how this works, because from the ovary to the fallopian tube, it's a one-way street, right? Down and out. Well, apparently, this endometrious tissue can actually go up the follicular tubes and get into the ovary or onto the ovary, and it can produce a cyst as well. All right. Some women develop a condition called polycystic ovary syndrome. This condition means that the ovaries contain a large number of small cysts. It also can cause the ovaries to enlarge, and if left untreated, polycystic ovaries can cause infertility. Now, I will just tell you, and I learned this from a holistic gynecologist, all right? The gynecologists of today, if you're just having trouble getting pregnant, they're going to just label you PCOS, polycystic ovary syndrome. I thought, because I learned it this way, if they do an ultrasound and they see all these little cysts on your ovaries, then yes, the diagnosis of polycystic ovary syndrome is the right diagnosis. Many women come in here and they tell me they've been diagnosed with PCOS, never have seen an ultrasound of their ovaries. They've never had an ultrasound of their ovaries. So in my opinion, I don't know that that really is what's going on with them. It's kind of a catch-all thing. Back in the 50s and 60s, when they couldn't find out what was wrong with you, they would call it your nerves. This is kind of the same kind of thing. They just list you as PCOS, and it might not really be PCOS. So if your doctor tells you that that's what you have, I would say, show me the money. Show me the ultrasound on my ovaries that I can see that I have that. And it's very, very, you don't have to have a medical degree to figure that out. You look at it and you got little spots all throughout your ovaries, and they're not supposed to be there. So if you do, in fact, have polycystic ovary disease, we've seen people that have had literal sonograms that have the cyst on the ovaries. In a short while, 6 months, 9 months, they go back to the doctor, they do it again, 0 cysts. So your body can heal itself, I'm just telling you. All right, so if you have an ovarian cyst, sometimes, most of the time, they don't cause any symptoms. However, they can have symptoms as the cyst grows. You can have abdominal bloating and swelling. I turn the page. Painful intercourse, pain in your lower back or in your thighs, breast tenderness, nausea, and vomiting. Okay. Severe symptoms include severe or sharp pelvic pain, fever, faintness or dizziness, and then rapid breathing. These symptoms can indicate a ruptured cyst or an ovarian torsion. That's where your ovary is hooked up to your fallopian tubes and it twists. It cuts off the blood supply, and it's going to be very painful. Why? Because everybody wants to live. Everybody wants to survive, even your little ovary. And so you got to go. They got to go in there. They got to untwist it, and you're going to be okay. But if you have those severe symptoms, it could be something else going on. I have never had an ovarian cyst. I don't know what this feels like. My daughter has had one. She said she thought she was going to die, and it was just a cyst that burst, and it was extremely painful. So you don't want to do this. Now, in holistic world, right? Holistic world, that's where we operate. A cyst is the body saying this particular whatever, okay, we don't know what it is, but this particular whatever does not belong here. The channels of elimination are not flowing like they should be, all right? Your bowel, your bladder, your lungs, your skin, right? So something gets stuck. Your body doesn't like it, so your body encapsulates it in a cyst. A cyst is usually kind of soft. If you do not resolve that issue, then that cyst can become harder. It becomes more strongly encapsulated, and that becomes a tumor, right? So in holistic world, we think, what is the body trying to close off that is hurting us, right? It's trying to protect us. So what is in that cyst to make that cyst be there? And so we go in there, we open up all the emunctories, we do all the things that we do, and quite often your cyst will just dissolve because the body goes, oh, channels of elimination are open, we don't need this anymore, and so we just kind of move forward on that. Now, most ovarian cysts are benign. There's absolutely no problem. However, as I said before, sometimes the blood supply can be cut off, and if not treated, this can cause damage or even death to the ovarian tissue. We don't want that. It is uncommon, but ovarian torsion, that's where it twists, accounts for nearly 3% of emergency gynecological surgeries. Ruptured cysts also are rare. They can cause intense pain and internal bleeding, and this is a complication that may risk infection and can be life-threatening if untreated. So if you have something that you feel is a problem, then you want to go to your OBGYN and say, I have really bad pelvic pain and I need to figure that out. I will just tell you, in holistic world, depending on what your history is and that kind of thing, if you're coming to me and you're telling me Dr. Polly, my ovaries hurt all the time and I have painful intercourse, I'm going to send you to a lab and get the CA 125 test. Why am I going to do that? Because that is the test for ovarian cancer. And what you may be looking at is something going on in the ovaries. It may not be cancer, but depending on what that number is, we can tell if you're headed that way or not, and then we can do some things holistically to get you where you need to be. So what I don't want you to do is I don't want you to be afraid to get yourself checked out, because almost everything can be resolved very, very easily. Of course, if you are having a heart attack, don't come see me, go to the doctor. If you are in a road accident, any kind of accident that is life-threatening, you want to get to the hospital, because they are absolutely fabulous of doing that, okay, taking care of that. So when you are going to the doctor to diagnose an ovarian cyst, they're going to do a CAT scan, they're going to do an MRI, and they might do an ultrasound, as I say, with the polycystic ovaries. Most cysts will disappear on their own within a few weeks or months, and so your doctor probably will not recommend a treatment plan, okay? Over a longer period of time, if there are no changes, there may be a treatment plan. Like I say, in holistic world, what we do is we ask the body, and yes, your body will talk to me. We've got the tools that channel your energetic vibrational frequencies and tell me if you're vibrating at the appropriate level or if you're not. If you're not, there's something going on nutritionally that we can go in and we can look at, and we can kind of get your body doing what it needs to do. And when your body does what it needs to do, it doesn't need to make a cyst. So the main key takeaways: when your body functions the way your body is supposed to function, you are free of sickness and disease. If you have anything wrong with you, pituitary related or ovarian related, right? Those are our two questions today. If you have those things, then you're going to know that there's something going on with my digestive system that is not quite right yet. We have maybe nutrients not getting where they need to be. We've got toxicity not able to get out, and so we need to do whatever remedial functions we need to do so that we can clear that. Then the body does not need to produce a cyst. Producing a cyst, producing a tumor is not a normal, healthy activity, right? Is it life-threatening? Not necessarily. However, we want to live in optimum health. I want to live in optimum health. So we listen to what our body's saying. We look at our body holistically, and we find out what's going in a way that we need to resolve. We resolve that, and then normally all the things just kind of go away. So I've used up all of my time again. I've got a couple more questions that we did not get to, so hopefully we will get to that next week. If you have questions, if there's something that you want to know about, if we didn't answer exactly your particular concern, make sure you're asking me detailed questions so that I can really hone in on that and give you what you need. It is my absolute pleasure to be with you on Friday afternoons. Please like, please share, please comment, because anytime we have those interactions, Facebook thinks that this is valuable, and it boosts us up in the algorithms, and we appreciate that. We know that there are a lot of people that need to know this information. So thank you again. It is the weekend. Take care of yourself. What are you doing for self-care? That's a question I'm asking you today, and I will talk to you next week. Take care.